Ever had a minor accident in the house where you may have cut your finger, or your little one playing outside comes running in with a cut, or has bumped his head, or, oh, mommy, I have a headache? Well, My Care Mobile has the perfect thing for you and your family. That's the My Care Mobile Deluxe Family First Aid Kit. Deluxe, you say? Yes, Deluxe. This wonderful first aid kit is not only stocked with all of the wonderful items that can take care of small emergencies in the house, from cough syrup to band-aids, thermometers, masks, you name it, but it also comes with a contents list which outlines exactly what everything should be used for. Plus, and listen carefully, My Care Mobile, when you purchase the My Care Mobile Deluxe First Aid Kit for your family, will also give you one free consultation, good for up to a year after you purchase this beautiful first aid box. And you will be able to consult with a doctor from the comfort of your home or office or on the go. So please reach out to us. Order your first aid mobile care kit before they are all gone. My Care Mobile.
The concern that she presents with predominantly is, of course, some acne. I'm going to recommend that we put Claudine onto a range called Clarity. And in particular, the product we're going to use on her is called Clarity Corrective AM. So one of the key technologies in here is a tiny little protein that is found, believe it or not, in human tears. And it is a very naturally occurring protein that will help decrease all these bacteria in her skin by quite literally killing them off, but without harming the other bacteria.
Good day to each and every one of you. My name is Karen Hendrickson, and I'm delighted to say today I am your presenter of the first in a series of My Care Mobile webinars. My Care Mobile, you're wondering, where have I heard that name before? Well, it's brand new. We were formerly of eHealth, and it is a subsidiary of Rabito Clinic, that name of which you do know, but we've changed the name to be My Care Mobile. And the whole purpose of this webinar and the webinars going forward is to ensure that you, our viewer, continues to get real news all the time. So this will be your authority on the news, and particularly as it relates to medical and your health and your well-being. We will cover a diverse set of topics over the time, but for today, we have a very special topic. And I think all of us can relate to it. And the topic is there really a cure for the pimples on my face? Well, without further ado, let me introduce to you my special guest, the one, the only, Professor Dele. Many of you know as the foremost personality and professor on dermatology, not just in Africa, but in the world. We are lucky enough to have him here today. But first, let me give you a tiny bit about his background. Professor Dele comes to us from Nandam in the Upper West region of Ghana. He has been a medical doctor specializing in dermatology for 50 years. So you know the wealth of information which he'll bring to us today will be information that you cannot and will not get anywhere else. And I'm proud to say that his passion and his compassion knows no bounds. And he is here today to share with you the information that relates to pimples or acne or rashes or bumps on your face. So without further ado, I would like to formally introduce you to Professor Dele.
Thank you, Karen. Thank you for your kind words. I'm also happy to be here with you. And Karen knows my favorite topic is about pimples.
Yes.
Yes, because I am of the view that your passport to society is your face. Nobody knows about what is happening in your stomach, but then everybody wants to look at your face. Society judges people more often than not by their face, the look of your face. After all, the rest of the body, you can wear clothes to cover them. But how many of us can cover our faces? Well, I know that there are, in the Muslim countries, there are some people who cover it, but still there is part of it left.
That shows.
And people will watch. And as I always say, being your passport to society, you must take good care of it. And in fact, in my 50 years of practice in dermatology, I've realized that people who have pimples, in simple language, worry about it. And they don't care whether there is war in Afghanistan or there is COVID. They care more about their face. And so it is a good topic for us to discuss. And we know definitely people would like to ask, as she rightly said, are pimples or acne curable?
So Professor Dele, sorry, before you go on, tell us what exactly is a pimple so we can understand, you know, because some people don't really know what it is.
You see, pimple is actually a bump on your face. But there are different other bumps, you know. You can have one due to insect bites, but this one called acne or pimples is related to your system.
Oh.
It's related to your system because even though we cannot pinpoint what exactly causes acne, but we know some factors which make you to have acne. And of course, as I always tell people, it is the most important dermatological entity. In fact, there is no part of the world where there is no acne.
Really?
Yes.
Does it affect, say, a certain age group or gender more than others?
Well, I think that it is normally said that it is more common in women. But no, I think it is because the women are more
Careful, yes.
Yes, they care this one. And then less than the men or the boys. But it is not true. I believe that it's because the women are more. But the good news is that the young men have it worse than the women.
Oh, really?
It is possible because the women are particular about it, because I always tell them, women always have their mirror. So they look at the mirror to see what is on my face.
Yes,
But
and as soon as something comes.
see something, they want to have it, yes. But maybe the bad news about acne is that most of them just consider that it's pimples. And that's all. So they don't report on time. And even those who try to know about it say, oh, but what? Don't worry about it. When you grow up, the pimples will go away.
I see.
You see, but it is not a good advice, because I think that it is always better to get a doctor and let the doctor make the correct diagnosis and make the, as you rightly said, it doesn't mean any bump on your face is pimples. In dermatology, we say that it's a particular type of bumps. That you see some points. Of course, there are technical names, but they will understand. Because the problem comes from your sebaceous glands, the gland that produces oil on your face.
Okay.
See what? And then the oil has to pass through a tube, which is the follicle, up to the top of the skin. Now, what happens is that in some cases, which is difficult to explain, some of them, these tubes are blocked. I wish they had something blocked.
We'll have it.
And some of them are deep.
Okay.
Some are open. Those which are deep, they are white. We call them white comedones. Those which are exposed to the sun, we call them black comedones. The good news is that for the specialists, it is not difficult. Because and even some of them, you take something, press it, and you see something pops out, coming like a snake.
Yes, yes.
And smelling in some cases. So it is actually coming from your sebaceous glands. And then what happens once it is blocked? What does it do? It goes back
in.
And then expands on the sebaceous gland. And definitely, if that continues, the sebaceous gland
gets blocked,
breaks up. Then it enters what we call your true skin. That is the dermis. And once it enters there, of course, the blood, those which protect you, try to get rid of it. And so those blood products like the leukocytes come, and actually it's a way of protecting the dermis. So they come together and gather.
I see.
Like to drive you away. You are not part of it. You are a stranger. So you can call it a foreign body.
I see.
So they cover you out. So they want, and that is why the bombs are deep. They are direct into the true skin. And they are deep, and a lot of them. And that is why you find them, those big bombs there. And so the skin's protection, the blood leukocytes, those which fight germs, come and cover it and say, look, you are not here at all. And that is then why you find out. So you have this one.
I see.
Yes.
So Professor Dele, is there like a certain age group of which people get it?
Definitely. That's, you see, that's why we call it acne juvenilis. Juvenilis means it's more common in the young people. You see, it's more common in young people. But it doesn't mean that old people don't have it, but they also have it. But more often than not, it is the younger ones, between ages of 12, 15, 17. It is found out that in boys, they have it at a later age, from 17, 18. But girls seem to have it earlier.
I see.
Yes.
So does it mean that there's only like one type of acne that all people get?
No. We have different types of acne.
Okay.
In fact, you can even have some of the acne we call cosmetic acne.
Oh.
For some of the things they apply on the skin, and if you go even to where people, the petrol dams, where you see them with this one, it's from the oils that they use. So you have oil acne. Then you have some creams that people use, and they call it acne medicamentous. They use some things there, and they create acne themselves.
Okay.
So they are also, that too it is not necessary. And the strange thing is that you even have it in newly born babies.
Really?
They have.
Oh, wow.
Yes, neonatal acne. But that, we believe, is coming from the hormones of the mother.
Okay.
And then for a short time, then
I
it
see.
clears. Yes.
So, Prof, if I'm understanding you right, and this is such a revelation, you can get acne both from your internal system. But also from the products that you use,
yes.
if you don't choose
yes,
the right
product,
products
yes,
for
yes,
your skin.
Yes.
My goodness, I bet you most of our viewers had no idea.
Oh, yes, you can get it from some of the creams.
Oh,
that is why we sometimes tell you that be careful of the creams you use. And we say, they are big words, but it's comedogenic. The comedos, some of these things produce it. So people have to be careful, especially the oily products.
Oh, I see.
Yes,
okay.
Because already the people who have the acne produce so much oil. That is why you see that some of them, you can even read it, they have oily faces, too much production of the oil.
Oil, I see.
Yes, and that is why we sometimes say that it's related to some hormones in your body.
I see.
You see, normally, the hormones are balanced. Some cases, particularly the women, their hormones, instead of having only female hormones, you know, the female hormones are there, then you have and this one. But they overproduce the male hormones. Oh. And that is what we call androgen, from the androgens, which are for men.
Okay.
And then they produce it a lot. And so you see these women, you don't even need to talk. You know that they grow beards.
Yes, we've seen that.
You see that.
Yes.
So you know that definitely there is a hormonal factor in that.
So it's like the hormones are fighting inside the body, and the male one is showing predominance.
So that if you see the women who have it, they tend to have hair.
I see.
And then it's very embarrassing.
Yes.
You see beautiful women with hairs there. And that's why we call in dermatology hirsutism. Oh. That means you are having a male type of hair growth.
I see.
And so that alone will let you know that there is a problem with this woman. And interestingly enough, one thing about dermatology is that we read you. And you see some of these women, if you just send them to do an X-ray, now, we tell them to do scans. You find out that these women, they have ovaries, polycystic ovaries. And then they have fibroids. So sometimes it's the dermatologist alone who will tell you that, please, go and do a test.
Wow, and that can all start with somebody coming for to find out about their acne.
Yes.
That's incredible.
Yes, that's why I tell the women, and I jokingly tell them, when I see them with fibroids, I said, you better get married quickly before your fibroids cover the whole place and you cannot give birth.
I see.
So that's why we collaborate with the gynecologist. So that if it is that, and when the acne is controlled, then we are able to, so sometimes gynecologists have to help us to resolve the problem. Also, because the women take pills, those pills which contain the more of the male hormones, that alone can create acne.
So is that women, like estrogen that sometimes I hear about?
They have to be very careful.
Okay.
And so, although some other pills too are able to clear the acne completely for you.
I see.
In fact, we are used to, in dermatology, to prescribe special pills for them. Of course, I'm a staunch Catholic, so I always advise my people that I'm not giving to you for contraception.
Right.
I'm giving it to you to reduce, to put it in order. So I'm doing it as therapeutic form and not that one. So it's there. The hormones do have a part to play. Okay. It's interesting to state just to prove the importance of hormones in creating acne, that the women who for one reason or the other, they remove their ovaries, they don't have acne.
Wow.
So women should
So
know.
there's a relation there.
So it's a practical proof
Yes.
that hormones play a part. And you know, if you go to those chiefs' houses, the kings, you know, when they want to have men to take care of their women,
Right.
and in the good old days, they made sure they were all castrated. So in castrated men, they don't have acne.
Wow.
So
But that's a severe price to pay.
Yes, that it states the importance of the value of acne, the triggers of acne.
I see.
So it says so. Hormonal. Most of the times, we want to check their hormonal profiles, find out the estrogens, the androgens, and just by helping to modify it, we can clear the pimples off.
I see.
Yeah.
So there's two takeaways from what you just said,
Yeah.
Prof, that is very interesting to me, and I'm sure to our viewers. The first is, not only is the face the passport to life, but it is also like the precursor of a raging war of hormones that could be happening in the person's body that ordinarily it wouldn't come to the light. That's the first thing. And then the second thing, which I think is great news, is that there are different methods of treating it, but it can be treated.
Treated, definitely.
I see.
Yes.
What are some of the most difficult form of acne that you have been able to treat in your 50-year history?
In fact, the most difficult one is what we call nodulocystic acne. They come with big bumps, and they are cysts, and the face is totally, they don't go out. They feel so, you can't face society. And then you see their noses are very big and oily. And that's what we call rhinophyma. And that's most difficult. But the good news for it is that we now have treatment. We clear it completely.
That's fantastic.
And it doesn't come back.
Oh my, that is absolutely fantastic.
So the people should know that now acne is curable. Because with the new products we have in the market, and one we have studied since 1986 in Ravito Clinic, please don't be afraid if you come and we give you this new, which these are retinoids. They are called isotretinoin.
Yes.
And they are derived from the vitamin A products. And if we show you pictures from Ravito where people came and had no hope, we were able to keep them on this treatment. You can use it as a mono treatment. That means you can use only that alone and a moisturizing cream, and they vanish and never come back. And that has nothing to do with age. Whether you are 16, 17, we use it and it works well. The only problem we have is with the young ladies and the beautiful women, because the side effect of this drug is that if you take it, you can't get pregnant, because if you get pregnant and get a child, the child becomes abnormal.
Oh, I see.
And so when you are to be put on this treatment, we advise you that, one, we must make sure first you are not pregnant.
Right.
You have to sign a document with us that when you are taking this medicine, you will not get pregnant, which is not easy for the young people, but we tell them. So because of that, technically, leaving my Catholic faith, I warn them, this one, you must promise that. Of course, and some of the young girls say, no, as for me, but I say, no, you have to sign.
Yes.
Because in the event of something, the doctor will be held responsible.
Yes. But you see, they all want the beautiful face.
Yes.
So they're willing to invest the time.
They will invest the time.
About now, that is, like you said, the most difficult cases to treat, which are treatable. What is the average time, say, for the most serious case to where the person's face returns to normal? How long does that take with medication, roughly? I know it's different for everyone.
It's different for everyone, but generally speaking, this is where the trouble is. If you don't take things like agnotin and the others, it takes a long time to clear. Using the other methods, like giving them antibiotics and giving them creams, that takes a very long time.
I see.
That is why these days, fortunately for us, agnotin is now used, the isotretinoin is now used not only for nodulocystic. Until a few years ago, we were always saying that if you have nodulocystic acne, use it. But now, we use it for mild acne. And even because it depends upon how the patient feels.
Yes.
If he's shy, he's somebody who can, you must, and what we call recalcitrant acne. One that you use the antibiotics, because you see, the easiest way of treating acne, especially the pustular ones, is to use antibiotics.
Yes.
Tetracycline, minocycline, and it takes a long time. That's
And
why
people get discouraged.
they get discouraged.
Yes.
But that's unfortunate because you give yourself, I always tell my patients, before you know whether this drug is working, give yourself at least 6 to 8 weeks.
Okay.
And then it gets bad
Yes.
before it gets good. So that is also one thing which the patients have to understand.
Okay.
I've already told you that it's down deep
Yes.
in the. So what happens is that once we start putting the drugs, what does it do? It says you are not wanted here. We'll throw you out. So there is always a flare up.
I see.
And the patients really don't understand. So I went to Rabito and they gave me this spoil, and I said no.
Be patient.
This is surfacing of the lesions.
I
We are
see.
taking it out. He says no. We have come. We want to throw you out, and you see it. In this case, actually, our illiterate sisters and brothers, they are better. They say, "Adieno eba." It's coming out. They tell you that but then the literate people is that. Another thing I notice is that because the girls or the boys are anxious to let it go, they apply the creams too much. Because these creams, you just apply very lightly. And also because some of these creams, particularly those which really help to clear acne,
Yes.
they are photosensitive. So we don't like them to use them in the sun. You apply it lightly at night. And some of them are irritant.
I see.
There
so they
is
get.
nothing, yeah, so they irritate and they want to. So I always tell them, don't worry. First, it is because I had an interesting case of, we can't mention the name, a lawyer, we joke. I said, lawyer, I put it to you that you applied it too much. And she started laughing, you are right. No, I want it to go, I don't like it. But when you over-apply it,
It's
then
as bad as
it's
not.
Yes. So when that happens, they shouldn't be frightened. They come
see.
and I explain to them, no, use it very lightly.
Got
It will
it.
go. Or suspend it for a day or two, 2 days, and then you reapply
see.
lightly, it will go.
I see.
Because but fortunately, the pharmaceutical companies are great. They have been able to modify it and make it
Okay.
in such a way that it doesn't give the irritation it used to give years ago.
Oh, okay.
It used to. The only disadvantage with the treatment of acne is one, time.
Okay.
It takes time to clear. 6 months to even about a year or 2. If you are using the ordinary method of antibiotics,
Yes.
creams and soaps and this one. But if you are using what I've said, the retinoids,
Yes.
that one, normally 6 months
Once
it clears.
it's gone.
And it doesn't come back again. But there are triggers too.
Okay.
We are talking. There are triggers.
I was going to ask you.
There are triggers. For instance, I always advise patients that if you want your acne to go, stop applying oil on your face. The face is already oily, and you apply it. When you are buying your cosmetics, make sure that the cosmetics are water-based and not oil-based.
Have you ever had a minor accident in the house where you may have cut your finger, or your little one playing outside comes running in with a cut, or has bumped his head, or, oh, mommy, I have a headache? Well, MyCare Mobile has the perfect thing for you and your family. That's the MyCare Mobile Deluxe Family First Aid Kit. Deluxe, you say? Yes, Deluxe. This wonderful first aid kit is not only stocked with all of the wonderful items that can take care of small emergencies in the house, from cough syrup to Band-Aids, thermometers, masks, you name it. But it also comes with a contents list which outlines exactly what everything should be used for. Plus, and listen carefully, My Care Mobile. When you purchase the My Care Mobile Deluxe First Aid Kit for your family, will also give you one free consultation, good for up to a year after you purchase this beautiful first aid box. And you will be able to consult with a doctor from the comfort of your home or office or on the go. So please reach out to us. Order your first aid mobile care kit before they are all gone. My Care Mobile.
The concern that she presents with predominantly is, of course, some acne. I'm going to recommend that we put Claudine onto a range called Clarity. And in particular, the product we're going to use on her is called Clarity Corrective AM. So one of the key technologies in here is a tiny little protein that is found, believe it or not, in human tears. And it is a very naturally occurring protein that will help decrease all these bacteria in her skin by quite literally killing them off, but without harming the other bacteria.
Say that your food.
Yeah. Oh, food.
Very
that has
important.
an impact. Okay.
Yes. Formerly, people used to joke and say, "Oh, doesn't it has?"
Okay.
I've been in it.
What are some of the triggers?
Yeah, the food.
Okay.
Milk, for instance.
Really?
There is clear evidence, and my patients now agree. Practical thing that they realize it. But I say, I like milk. I say, okay, do you want a beautiful
Exactly.
milk on your milk? So when they reduce that, we find out that
Okay.
nuts.
Nuts. Okay.
You know, particularly the chocolates with the nuts, which I
Yes,
love.
me too.
So they take it, and they themselves will come and tell me, hey, you were right. In fact, I was with one today, and I said, tell me, you know I've got your face fine, but are you able to obey the instruction? He said, I beg you, I hide and take once in a while. And then shrimps and crabs.
Oh,
Yes, shrimps
that's
and crabs.
interesting.
So you go and they do it and they come back and I tell you what happened. I went to Chinese restaurant. Boom! You have
Wow.
inflation.
Okay.
Another important factor, triggering factor, is actually anxiety, worry, and anxiety.
Stress. Oh, that's a tough one.
Because when we were young, you know, and even now, people think that, oh, don't worry, when you marry, your pimples will go.
Yes.
And I said, it's not easy. If you marry and you are
The stress.
yes. And then it has been proved without doubt
Oh, wow.
that when students, we told you, are about to do exams,
Oh, they have
they
flare-ups.
have flare-ups.
Oh, wow.
And so those are some of the triggers which make it to
I
come.
see.
So those things are clear, and the patients,
Okay.
after 50 years, we are able to find in look, Kelewele and the nurse, with the and they go, oh, but allow me to. I said, look, let's clear it once a
see.
while.
Yes.
And they come back and tell me, yes, you were right. The other day, I went and bought with it, and I said, and sometimes only one bomb comes.
Oh, I see.
Oh, yes,
Okay.
very interesting.
Yes.
Practically, is so interesting. And then they confess. I know an interesting case where the husband came with the wife and was so happy. Then after 6-8 weeks, she came and there was a bomb here. So he said, let my husband go out. I'll tell you the secret. The husband went out. I said, oh, no. She was hiding the chocolate. So we laughed. I said, I won't betray you. But once you know that.
It's the
that
chocolate,
is, so,
yes,
so
exactly.
That one. So people were saying that, but they do have an influence.
Oh, okay.
Another interesting thing, practical thing in dermatology that we found about people with acne is the way you sleep at night.
Really?
Put your thing on your pillow and you come out, tell you, last night you slept on your right side. I say, how do you know? Yes, because of the trauma on it. It comes and that place flares. And I always tell them, when you sit down, don't do this. Where you put your hand, you come back that place. So there is the question of trauma, pressure on it. And it's interesting to note, these days with our wearing these, patients come. And when they put it on for a long time, where they cover it, the acne comes. So it's a trigger now.
I see.
It's proved by me.
Okay.
In the clinic. So I tell them, don't keep the mask for a long time.
Okay.
And
They need
you-
to be changing
you'll
the
be changing
mask.
it. Yes.
Yes.
And don't keep it on for too long.
Yes.
And I tell my patients and they laugh and they are doing it and we are getting success. You know, I tell them now, if you want it to clear, when you go to bed, you know when you are going to the airline, they
Yes.
give you this thing to
Yes.
put it on and lie like that.
Oh.
So that you don't turn left or right.
Okay.
And you come and see within a short time they clear because it's the pressure.
Oh, I
So
see.
these are, and they only come from practical life. You
see.
interview the patients and they tell you.
Okay.
You see, so these things are some of the
see.
things that, and of course, nothing else to say. The creams that they use for making their skins fair,
Yeah.
their
Oh.
faces, the bleaching creams,
Yeah.
they create cases of acne.
Oh, I see.
Yes,
Oh,
this
my goodness.
medicamentosa. And then some of the creams they go and buy in the market, like triple action creams, fan backed and all those. They are not, they by themselves
Cannot,
it can
right.
irritate the place and then
And make
this
it worse.
one, make
Yes,
it worse.
yes.
Or even provoke it.
I see.
Steroid acne.
Okay, so we have about 10 minutes left,
Yes.
Prof. But I'd like to just explore with you. You know, there are so many people on the market promising miracle cures overnight for acne, and people are trying to self-medicate and so forth. But in your 50 years as the world's authority on black skin in the tropics, what are some of the goals you look for when you're treating a patient where you can say, yes, this is the success markers? Can you share that with us?
Oh yes, you see, the problem with a black skin is this. The greatest problem with the black skin is that, contrary to what they were telling us, you know, during the slave trade, they shipped us out there and said we were very resistant to sawdust and all those, but they were all lies. Contrary, our skin is very sensitive.
Okay.
Contrary to, I did a research on it, and I also followed the old style, only to find out that we are very sensitive to. So what happens is, if you use creams on the black skin, it easily turns fair.
Okay.
That's why we are warning the people. These steroid creams, they buy them in the market and apply them. You easily turn fair. Or because our sun is very hot, you expose yourself to the sun. Then you have darkening of the face.
Yeah.
And in fact, that is more distressful to the black patient than to the white man. You have what we call post-inflammatory hypermelanosis. A big name, but it just says they have the dark spots. And after you've cleared everything completely, then you find it's there, and she's worried. How do I get rid of this?
That's what our listeners want to know. Is
Yes.
that possible to be safely removed, that dark
they can be
pigmentation?
removed. Fortunately, now we have products like azelaic acid. We now have some products which are found, and we help them to get rid of it.
Okay.
Yes, and then of course we try to tell them to use sun protectors.
Yes, that's
because, and that is something that we black people, Afro-Asians, we know what to do. But I always encourage them that don't forget that the sun is an enemy. It's good to us, but it's an enemy too.
I see.
We are very, very well protected by the melanin on our skin. That is why comparatively, black people, we don't easily get cancers.
Okay.
In fact, the cancers we have are on those parts which are not don't contain melanin. So you see,
I see.
This one. So we are lucky, but it doesn't protect us against the infrared. So you can also get wrinkles.
Oh.
Even though, so
Yes.
I always tell them, let them try and also use sun protection.
So that's another big takeaway. Sunscreen.
Yes. They shouldn't just
watch their
take
nutrition.
nutrition.
And the other takeaway I'm getting, Professor Dele, is they need to see qualified doctors who can really manage their treatment for them rather than just trying people ad hoc.
Yes, they should be very careful. And I can confess that because of the different patients I see, we can always tailor the treatment to your pocket.
Aha, okay.
That is also important.
Yes.
People think that they will come and take. No, when I go to the rural areas, I use simple things like sulfur ointment, simple things like calamine, and they equally, because if you cannot afford, you adjust the treatment.
Exactly.
To see
but the thing is, though, I think most people, they want the results immediately.
This is the
and
trouble.
Whilst the other things that you mentioned might work just as well, but take much longer, they don't want that. So.
And I want to tell them that it is more economical to go first class.
Totally.
Because the products that we give to them, and that's why I was telling the insurance people. In fact, I'm happy to say that when I was in Kumasi the other day, and I was giving somebody Acne, and the bill was high, the girl said, no, I'll take it, but let's talk to the insurance. And when I spoke to the insurance and told them that it's cost effective to use that.
Exactly, because you get results.
In 6 months, but she has to travel all the way up and down. It's loss of job hours. And then if you calculate the amount they spend, it's not cost effective.
Absolutely.
Yes, it takes a long time and affects the spirit of the person. People don't know. Acne is a very serious disease. Even though they will tell you, don't worry, let it go. Why I don't agree with that, even though I know that some of them clear spontaneously, even without treatment. But in the modern world, you have to get the best.
Yes.
Your health is your wealth, and your face is your passport to society. So the earlier you approach us, the better. Because I cannot predict whether your face, the treatment I'm doing will give you scars. In fact, that is our fear. Another thing which comes, the scars on the face. You beautifully clear the acne, and the person has scars.
Yes.
And to get rid of the scars is another job.
I see. But it can be done.
It can be done.
Exactly.
And we promise them we are bringing lasers, and these lasers will smoothen the thing. We also have some anti-scar creams which are working marvelous. But I said long term.
Absolutely.
So avoid that by seeing the doctor earlier, so that we manage it and you don't have these we call the results of acne. We don't want that.
Absolutely.
We want, besides the fact that it will affect you psychologically, but your beauty,
Yes.
your face will be affected.
Absolutely.
So we always plead that they come early and seek help. Parents should not tell them, no, I had it at the age of 8 when I was 35. No. But do you know what it left on you?
Exactly.
So we now have the advantage with the media, with things like this, to educate people as we are doing, so that they know the earlier you come,
the better. Well, Professor Dele, I thank you for all of our viewers out there, because you have shared information that, especially us women, we want to know what we can do. We all get the pimples from time to time. And knowing that there is a cure in the right hands, and that you, as the founder and chief medical officer of Rabito, has had the experience that can get them to a beautiful passport.
Thank you. Thank you. We are always there.
Thank
and
you.
We are praying to God that we will continue to deliver our best services to all Ghanaians, to all people. You know, we have some of our customers calling us from Russia, from Germany, from the UK, and I'm dealing with them and I'm treating them. Particularly the people with the black skin. Because even some of the creams, the concentrations they give to us,
the wrong
they are not very suitable for us.
See.
So it is better we adjust ourselves and then get creams which they were made particularly for the white skin and not necessarily for the black skin. So as much as possible, we have to monitor and adjust it, and also our weather, the humidity.
Yes, so this is
the sweating and so forth. We need to consider all these things. But I always insist on my acne patients, please, your food.
Yes, your food,
Eat
folks.
a lot of vegetables.
Yes.
Drink water.
Stay away.
Smile.
Yes, a smile is the biggest treatment.
Smile, nobody will even see you have pimples. Thank you.
Absolutely. Thank you so much, Professor Dele. We are going to take some questions at the end, and I'd like to invite our audience to send in questions. The information you have received here is priceless, absolutely priceless. And it's a shameless plug for Rabito, but Rabito is the foremost authority on this topic on this continent. And you have Professor Dele himself here. So I'm sure you'd all like us to give him a large round of applause for his time and his candidness with the how to get rid of those pimples on your face. Ever had a minor accident in the house where you may have cut your finger, or your little one playing outside comes running in with a cut, or has bumped his head, or, oh, mommy, I have a headache? Well, MyCare Mobile has the perfect thing for you and your family. That's the MyCare Mobile Deluxe Family First Aid Kit. Deluxe, you say? Yes, Deluxe. This wonderful first aid kit is not only stocked with all of the wonderful items that can take care of small emergencies in the house, from cough syrup to Band-Aids, thermometers, masks, you name it, but it also comes with a contents list which outlines exactly what everything should be used for. Plus, and listen carefully, MyCare Mobile, when you purchase the MyCare Mobile Deluxe First Aid Kit for your family, will also give you one free consultation good for up to a year after you purchase this beautiful first aid box. And you will be able to consult with a doctor from the comfort of your home or office or on the go. So please reach out to us. Order your first aid mobile care kit before they are all gone. My Care Mobile.
The concern that she presents with predominantly is, of course, some acne. I'm going to recommend that we put Claudine onto a range called Clarity. And in particular, the product we're going to use on her is called Clarity Corrective AM. So one of the key technologies in here is a tiny little protein that is found, believe it or not, in human tears. And it is a very naturally occurring protein that will help decrease all these bacteria in her skin by quite literally killing them off, but without harming the other bacteria.